Welcome to Vertical Movement PT. I'm Dr. Cindy Kinney, physical therapist, and today we are going to learn how to use the Theracane to help reduce neck stiffness. So go ahead and grab your Theracane, find a comfy spot, and let's get started. First, we're going to go ahead and learn how to use the Theracane to help improve flexion and extension of your neck. So what you're going to find somewhere along the cane is a place that has two little nubs. This is going to go on the side of the back of your neck, and the spine is going to go right in the middle. So just like this, you can see how the nubs are on the side of the spine. And after you get a good grip, you're going to go ahead and start from the top. Make sure that the little nubs are centered and the pressure is equal. You're going to go ahead and flex your head forward, adding a little bit of pressure going forward, so pressure pulling the Theracane forward. And you're going to go ahead and do this 10 times. So after you do that 10 times, you're going to bring the Theracane a little bit lower to a different vertebrae, to a different segment, and the exact same thing. Applying the pressure forward, and you're going to go ahead and flex your neck down and back up. After you do 10 of those, go down to the lower segment until you're all the way down to the base. After you do the flexion portion, you're going to go back to the top, and you're going to do the same thing, pulling the Theracane forward, and you're going to extend backwards. So you do 10 of those, and after you do 10 of those, you're going to go to a lower segment and the exact same thing. Next, we're going to go ahead and learn how to use the Theracane to improve our rotation of our neck. So if you ever find that you wake up early in the morning and you try turning to the right or turning to the left and you can't, this one is perfect for you. So just keep in mind, do this very gently and do not be forceful with the Theracane, okay? So place the pointy part, so not so much the round part because that will slip away. Place the pointy part on the side of the back part of your neck. So in the middle here, you have the spinous processes, and you want to place the pointy part here on the side of the spinous processes. Okay, so if I want to work on my left rotation, you're going to place this on the right part of the back of the neck, and you're going to go ahead and rotate and back. So I'm applying a bit of a pressure with the Theracane to kind of help bring that vertebrae around and back forward. So you don't want to force this motion. You want to only apply a gentle pressure. Alright, so you're going to go ahead and do 10 of these, and after you do 10 of these, you're going to go a little bit lower down to the next vertebrae. And don't worry about getting it exactly, because there's 7 vertebrae, you're not going to get the point exactly on it, so just do your best. And you're going to go ahead and rotate. So you're going to do 10 of those. And after you do 10 of those, you're going to go ahead and do the same thing, going lower, doing 10, going lower, down to another vertebrae, doing 10. After you do 10 on the right side, turning to the left, you're going to switch it up, place the little nub on the back of the left side of the neck. And then you're going to go ahead and rotate to the right. You want to repeat that 10 times, going all the way down the neck. Next, we're going to go ahead and stretch out our scalene muscles. And the scalene muscles are on the side of our neck. There's 3 of them. We have the anterior, middle, and posterior scalene. So you're going to go ahead and pick the rounded part of the Theracane, not the pointy part, because you will regret that. And you're going to go ahead and place it right here in the region where the anterior and middle and posterior scalene insert to. They insert into the first and second rib. So you're going to go ahead and push down gently. You want to keep in mind in this area, there's something called the brachial plexus, and that's a bundle of arteries, nerves, and veins that come out of that area and go down your arm. So if you find that your hand starts getting a little tingly, go ahead, lift up that Theracane, pick another spot because you do not want to compress your nerve. So you're going to go ahead, apply a very gentle pressure down, and you're going to go ahead and side bend your head the opposite direction. And what that's doing, it's stretching out that muscle, because with the Theracane, you're adding a tack So you're tacking down the muscle. And then by moving your head the opposite direction, you're adding a stretch. So this technique is called attack and stretch. The scalene muscles, it originates and attaches to the side of your neck here, to the vertebrae. So by side bending your head the opposite direction, you're adding that stretch. So after doing about 10 of these side bends, you can go ahead and switch to the opposite side and place the little pointy part of the Theracane onto that first rib, second rib region, and you're gonna side bend the opposite direction. You should feel a nice stretch on the side of the neck. Just keep in mind you wanna do this very slowly. You wanna be gentle with the pressure of the Theracane. Be nice to yourself. Lastly, we're gonna learn how to mobilize our first rib. Why do you wanna mobilize your first rib? Because it's really common for that rib to get cramped up and elevated, and that causes the side of the scalene muscles to also get tight since they attach to the first rib. So what you're going to do, you're going to place the rounded part of the Theracane onto the first rib. And where is the first rib? I bet you're wondering that. I bet you didn't even know you had a first rib that high. And what you're going to do, you can kind of poke on that area. It's kind of like the upper part of your back, and you should feel something bony. You're going to place the nub right on top of there, and you're going to hold onto the lever right here on the top. And I'm going to do oscillations of pushing down in this speed and this motion, just like that. So I'm pushing down that first rib. You want to go ahead and do this for about 30 seconds and then take a break, and you can repeat it up to 3 times. All right, there you have it. You have just learned a few tips and tricks of how to use the Theracane to reduce neck stiffness. I am so happy that you were here with me today. If you like my channel, go ahead and subscribe, but I will see you next time. Peace.